Some of you may be experiencing lower back or leg pain that makes standing and walking an uncomfortable part of life. Maybe the only relief is just plain sitting down. Dr. Michael Gilbert, owner of Gilbert Physical Therapy, is here to explain stenosis of the lower back and how to treat it. Welcome back to the program.
Thank you.
So stenosis, what is that? What does that mean?
So like we've talked about before, 1 in 4 visits to a primary care physician is for lower back pain. And lower back pain comes in many different forms. So stenosis is a very common form of back pain that is going to affect not only the back but also refer symptoms into the legs.
Okay.
And the hallmark of this is stenosis will be the progressive narrowing of what's called the foramina. The foramina is a tiny little space in between the vertebrae where a nerve will exit.
Okay.
So
is that what this is here? Is that a nerve?
That is exactly what that is. So in stenosis, that space will decrease and it will put a pressure onto that nerve. So when that compression happens, it can refer a symptom down into the leg. And usually this will happen with folks usually older in life.
So how do folks know if that indeed is what's going on?
So the good news is that with research now, we've been able to identify a couple key questions in order to see if folks have stenosis. One is going to be that folks over the age of 50 generally are more likely to have stenosis. It's going to have pain with standing and walking, primarily in the back or down the leg, and it's going to have symptoms that are relieved with sitting, and also too, some people will have relief if they bend over a shopping cart when they're walking.
Okay, so that's just kind of temporary relief, but I know that there are treatments. Of course, you always bring that good news to us. So what can you do then in physical therapy to make this better?
So in physical therapy, what we do are a variety of techniques to open up the space. So we will match specific exercises to create an opening and relieve the pressure on the nerve. We'll do that through a variety of exercises, hands-on techniques, and sometimes we'll utilize traction as well to open, which is a specialized treatment that we have at our clinic.
I've actually had that done to me for a pinched nerve, not in the lower back, but in the upper back. This is also what we love about you, is you bring offers to our viewers. So what is your offer this month?
So today we actually have 2 offers.
Oh,
One is going to be, we're going to give away 10 free screens for folks who meet this stenosis criteria. So what we're looking for is someone who has insurance, is over the age of 50, has pain and symptoms in the back with standing or walking, that is relieved with sitting.
Okay.
And as a special bonus, what we're going to do is we're going to give away a copy of our book today as well, which is called Pain-Free Motion for Your Lower Back, Relief Without Medication, Injection, or Surgery. And we will give that away to everybody who calls in today above and beyond even the 10 free screens.
And you wrote this. This is your book.
And this is our book.
That is wonderful. So just walk me through just briefly, like what Gilbert Physical Therapy is like, what the office is like.
So when you first come into our office, you're greeted by our receptionist. If you're there for your initial appointment, we'll take in your intake information, which is generally consists of a basic history. We come in, you have a one-on-one evaluation with one of our therapists, and then we set up an individualized plan tailored to the specific needs of you.
Very good. And where are you located?
We are located on the Carlisle Pike in Mechanicsburg.
Very good, very good. And we've been putting your contact information there on the screen, gilbertpt.com. And again, anybody can call and get this book, Pain-Free Motion for Your Lower Back, which I'm sure could help so many folks.
It would help a lot of people.
Because like you said, that is the common complaint of folks who come, the lower back.
Absolutely.
Okay, thank you so much, Dr. Gilbert.
You're
Great
welcome.
to see you again.